Good evening and warm welcome to everyone for today's English webinar. And today is our 1988th day of continuous webinar. Thank you everyone for joining with us. And today's our speaker is Dr. Manisha Boricha. She's MD, Homeopathy and PhD, Professor in the Department of Organon of Medicine and Homeopathic Philosophy, and Academic Head of Swami Vivekananda Homeopathic Medical College, Gujarat, Homeopathic Clinician, and diet and nutritionist and psychological counselor. And she participated in many webinar, many researches, many seminars. I'm not mentioning one by one. Anyway, I'm welcoming you, Dr. Manisha Boricha, to our English webinar. You are most welcome. Please.
Thank you so much, ma'am. Namaskaram. So, shall I start?
Yes, sure.
Okay, so today we discuss about there is exploring the clinical application of SARCODES. Next.
Wait. Actually, I was lagging, but okay. You continue.
Okay, continue, ma'am. Okay. So basically, first discuss we about what is a SARCODE. So it is in homeopathy. Just ma'am, slide is changed. Okay.
Third one, huh? Third one, right?
Yes. Right. So second one, ma'am.
Second one, huh?
Huh. Okay. So SARCODES in the homeopathy, the medicine is prepared from the vegetable kingdom, animal kingdom, mineral kingdom, and another it is there is a SARCODES, nosodes, and the imponderabilia. So first we discuss about the basic introductions. What is SARCODE? So SARCODE, it is a Greek word. SARCODE means it is a fleshy. SARCODES imply there is a protoplasm of animal and distinguished from the vegetable protoplasm. Protoplasm, what is protoplasm? So it is a living substance in the cell, and it is term is the historical. It is applied protoplasm to protozoa, semi-fluid content of a protozoan. Next. In the homeopathy SARCODES, it is proven remedies, and the prepared from there is a healthy animal tissues or the secretions, and they represent there is a physiological there is a physiological organ functions obtained from there is a normal secretion of a humans and the lower animals, mostly hormones and enzymes, and it is basically it is adrenalinum, pepsinum, pancreatinum, insulin, thyroidinum, etc. All are there is a SARCODES. Next. Historical background, first of all, in the 1834, there is a Constantine herring. It is used as the organ tissue in the treatment, and afterward, it is usually it is action for there is a dysfunction of corresponding the organ. So it is considered as organ remedies, particular for the organs. Next. So organ remedies, it is based on the homeopathy. It is the SARCODES and nosodes. SARCODES is prepared from there is healthy tissues, and nosode it is prepared from there is a abnormal tissues or the diseased tissues. Next. So based on the concept of the tissue remedy or the tissue memories, we can consider it is prepared from there is a similar tissues. Next. In the nosode, we prepared medicine from there is a abnormal tissues, and the SARCODES is prepared from there is the healthy tissues. Next, action of a SARCODES. Action, it is first, it is considered as a constitutional remedy. Make out there is a complete picture, and you can select the simillimum as a constitutional remedy. Second, as an intercurrent remedy. So it is used in the frequently in between there is enhance the action of a previous medicines. Third one, it is required when the paucity of a symptoms, when the symptoms is lacking or there are the chaotic symptoms, or in the case where is the qualitative symptoms is less and the quantitative symptoms is much. Act as an antidote, as consider as a follicular anemia. It's a very good remedy used as the overdose of OC pills. Next, it is the act as complementary medicines. So whenever the thyroid is used when calcarea force is arrest development in the children, follicular anemia act as a complementary medicine in the after the application of a, or the administration of a lachesis in the female complaint. So it is the organ remedies like thyroid in the particular goiter, hypo or the hyperthyroidism. As a prophylactic, it is act as a lectin in the diphtheria. It is helping to remove the miasmatic blockage as well. It stimulates the cell reactivity and it promotes there is a regenerations and the multiplication of tissue cells when it required. Next. Classification on the base of a preparation, it is basic 4 classifications: SARCODES from the whole endocrine gland, SARCODES from the healthy secretions, SARCODES from extract, and the other SARCODES. Next. So first of all, SARCODE from there is a whole endocrine gland. So it is prepared from there is a whole endocrine gland. It is the glandular dysfunctions, what we called it is the thyroidinum or pituitaria posterium. It is basically, it is prepared from there is a whole endocrine gland. Next. Prepared from the healthy secretions, it is the physiological secretions. Mostly it is the hormonal secretions like adrenalinum, insulinum, estrogen, progesterones. All are there is a physiological secretions. Next. Prepared from there is extract. So it is extract of organs and the tissues. It is a functional disorders like ofurinum. It is prepared from there is a ovarian extract. Next. Other, it is the prepared from the animal organs or the substance. Usually there is a based on there is a similarity and it is like a faltory. It is the bile of a bovine gallbladder. It is prepared from that and it is used in the particular case of a stone of a gallbladder. Next. So list of the SARCODES. The all are there is the multiple remedies as involved in the SARCODES. Next one. It is just like there is a adrenocorticotropics, there is a cerebrum, there is a cortex, there is a corticosteroids, testes. Next, all are the list. It is a faltory folliculinum, it is the histaminum, hippocampus. It is all about there is the included into the insulinum. There are the multiple remedies. SARCODES is include. Next. It is like a LEC series is also included into the SARCODES. LEC, we can consider it is LEC humanium, LEC leoninum, LEC DEF, LEC CAN, LEC equinium, all about it is included in these SARCODES. Next. So again, it is the LEC series include in there is another, it is the medicine ofurinum and it is the pituitaria, pepsinum, pancreatinum, all included into there is a SARCODES. Next. Again, it is a series of the SARCODES. Next. Thyroidinum and it is the valerina, everything it is included into the list of the SARCODES. Next one, ma'am. So preparation of a SARCODES, it is of a materials. Basically, it is the healthy glands or the tissue are the selected, and then there is the extra fat and the connective tissues are removed, and the material it is washed with there is a sterile water and the normal saline. Next one. Next step, it is a communication. So it is the material is finely chopped and there is a tissue cells may be triturate with the lactose and ensure there is a proper breakdown for the extraction. Third step, it is extraction. What we consider it is the macerations and the physiology to pathology. On the organon point of view, SARCODE represent there is the essence of a healthy tissue or the secretions. Normal physiological state exists first and the pathological it is developed because of there is a disturbance of the state. So it is the disturbed homeostasis, it means deviate there is a vital force. SARCODES help to restore the normal functions before the structural pathology. Next one. So normal function is equal to physiological balance. Disease it is the functional disturbance. Healthy animal tissue used in the therapeutic agents on the base of there is a similia similibus curenta. Next.
Dr. Manisha, can you open your camera?
Yeah, sure, ma'am. Okay, next one. So it is used basically in there is a functional disorders, hormonal imbalance, and endocrinal dysfunctions. Next, please. So what is the hormone? So it is produced by there is endocrine gland and it is a specific substance into there is a blood carried in the all part of the body. So first it is the role of there is a hormone. It is a regulate the metabolic functions in the case of there is a diabetes or thyroid complications. Second, it is control growth and development, like there is a puberty age, there is a developmental period. Influence, there is a reproductive functions related to female complaints, and affect there is emotional and the mental balance, particular the any kind of phases like a puberty, pregnancy or postpartum, or there is a menopausal or perimenopausal periods, act quickly in the minute quantities. Next one. So SARCODES as organopathic drugs, first it is act as there is organopathic remedies, specific organ and the glandular functions. Action limited to the function of the organ, specific organ and the specific conditions. Like offurinum, it is for there is ovarian cyst or PCOD. Next one. Clinical importance, it is the useful in the endocrinal disorders, menstrual irregularities, infertilities, thyroid and pituitary, ovarian dysfunctions, best suited for the functional and the early pathological stages. Next one. Uses of SARCODES in the female complaint, because it is the mostly there is a hormonal treatment, so it is specifically used in the female complaints. First one, it is the offurinum, so it is the ovarian extract, and it is used in there is the ovarian cyst, dysmenorrhea, irregular menses, sterilities, ovarian cyst, early or late menses or the scanty menses. Menopausal at the period of there is a climacteric period, when it is the pre or perimenopause period. Main action, it is the regulate there is the ovarian functions. Second one, it is the folliculinum. It is the prepare from there is the ovarian follicular hormone. It is basically used and there is estrogen dominance. When there is estrogen and the progesterone's balance, it is the disturbed. PMS with there is emotional disturbance, suppress the menses after there is a contraceptive pills. So we can consider as an antidote after the overdose of OC pills. PCOD, acne, leukorrhea, cystitis, ovarian dysfunctions, dysmenorrhea, infertility, as well as there is the menopause. The main action of a folliculinum, it is the balance the estrogen and progesterone level. Next one. Thyroidinum, as we know, it's prepared from the thyroid gland. The main, it is the hypo or the hyperthyroidism. The functions, it is almost it is irregular menses, hair fall, weight gain, infertility. There is a diffuse the toxic goiters, and there is a menstrual disorders. Main action to regulate there is endocrinal system to balance the axis. Pituitarium glandula, it is prepared from the pituitary extract, and it is used in there is it is a master of a gland, so we can consider it is a menstrual irregularity due to the pituitary dysfunctions. Lactation problems, puberty delay, is there are the obesities and uterine inertia. It is the main action to master the gland regulation. So it is the center and everything in the periphery. If it is in the center, it is everything is normal, so periphery it is always better. Next one. Corpus luteum, so it is prepared from there is a luteal tissues. It is mainly used in there is habitual abortions, multiple, there are the series of abortions, or in the luteal phase defect, any kind of after the phase, there is a second half of a menstruation, there is a rupture of the follicle, early ruptures, or there is continuous bleeding, short menstrual cycles. So it is the main action to improve there is the progesterone supports. Next, it is the mammalian. It is the mainly origin from there is the breast tissues. There is any kind of a disease condition related to the breast, like mastalgia, mastitis. There is fibrocystic breast disorders, or there is a breast tenderness. Main action, it is a regulate the breast tissue hormonal response. Next one. Estrogen and progesterone, the major hormones playing a role in the female during a life. So it is estrogen, it is the primary female sex hormone. It is definitely used into the development and the regulation of a female reproductive system. Secondary is sex characteristic, and it is the main action effect on there is a better growth development during the puberty period. Progesterone, it is the progestins, it is the endogenous steroids. It is used in there is a female reproductive hormone disorders, decreased sex drive or the libido. There is the depressions, unwanted hair growth, mood swings. There is a widow from the society. It's pre and the progesterone is acting very well. Next one. Placenta. It is origin from the placental extract, and it is used, and there is increased milk secretions in the nursing mothers. So it is main effect, it is the better the infant growth. Clostridium, it is the prepare from, there is the gland of a beaver, it is the Clostridium extract. It is used in, there is a female reproductive, and there is the hormonal disorders, anxiety, stress, restlessness, sleeping disorders, and it is main action, it is the calming actions. It's just like there is ambragracia, ignatia or murex. So it is act as a calming system. Next one. Next, it is the colostrum. It is the basically it is the first milk after the pregnancy or delivery. So it is used as there is enhance the immunity. It's like a defense mechanism, support the internal growth. There is a infant growth, and there is a during the dentitions and the emaciated child. There is a malnourished child. Liquor amni, it is the amniotic fluid, and it is prepared from there is amniotic fluid. It is basically used in the support the fetal, and there is a reproductive vitality. Next one. Pituitarium and anterium, it is the LH and FSH balance. It is basically action or main role on the hormones, PCOS, delayed puberty, amenorrhea, infertility. Adrenalinum, it is the adrenal hormonal imbalance, cortisol imbalance, and there is a stress induced hormone imbalance. Basically, there are the multiple steroids. It's used as there is a cortisones, corticosteroids frequently used in there is a balance of there is a stress induced hormonal conditions. Next one. Leg series, it is the basically in the female, it is the leccan and the leg Leccan, it is for there is a severe PMS, breast pain, and there is a cramps during a period. Leg deaf, in there is a periodical nausea and vomiting, anemia, and with there is a periodic headache. Next one. So it is all about there is a basic introduction of a sarcodes. We are going with there is a case series. First case, it's about there is a name Ekedesai, age 23 years, female, occupation study. She is single, Hindu, vegetarian, and address it is Bhavnagar, Gujarat. Next one. Chief complaint, absence of menses since 5 to 6 months, and diagnosis it is a PCO. Next one. Menstrual history, first menstruation, it is on the 13th year. Last menstruation on the 7th July 2023. Amenorrhea secondary, menses irregular, cycle 35 days, duration 7 days, flow profuse, color dark red, and it concomitant, there is before and the beginning of menstruation, it is dysmenorrhea, irritable, and mood swings. Next one. Associate complaints, skin, multiple warts, ODP, it is since 10 to 12 years, hereditary, her father has same problems, location under the right axilla and the genitals, color it is brownish, size it is small, texture soft, dry, and painless, type it is a flat and pedunculated warts. Next one. Physical characteristic, she is in appearance lean, thin, and beautiful. She is very pretty. Weight it is 52, and she reduced her weight in the 15 kg within a year. Perspiration scanty, desire spicy, +3 chocolate, and she is thirstless. Next one. Mind, her hobby, she loves to the dance. She is students, but on part time she managed the dance classes. She is choreographer also. She looks her future in the acting and wants to be a model. She wants to play a lead role in the for a film. She likes to dress up and make up. She wear particular clothes due to her clinic complaint of there is warts. That why she feels jealousy from others. She feels ugly and unhygienic. She feels conscious about her appearance. Next one. She likes the purple shades. In the purple shades, she feels happy and the calm. Bright colors are so loud, so she dislikes. She has conflict with her parents. Her parents don't like her activities. Her father looks her career in the further study like a PG or do practice in the clinic. Even she don't talk with her father since 2 years because of conflict. She has a fear of accident, dog bite, and the animal. Her nature is introvert, anxious, straightforward, and independent. Next. The treatment on the base of totality and the repertorial totality, I prescribe a Sepia 1M single dose with there is a Seclec TDS for a 1 month. Next. The follow-up, the chart is here. On the 7th July, it is the Sepia 1M with the single dose. On the 7th August, she feels better. So I'm going with, there is the Seclec for the 1 month. After the 8th September, she feels slight better. Again, I repeat, there is a Sepia 1M with the Seclec TDS for 1 month. On the 7th October, she feels not much improved, and I am not satisfied with there is a treatment. Next one. So I go with, there is an intercurrent remedy with, there is ofurinum 1M single dose. In between there is a sepia. Next. So result is here. There is ovarian enlargement with swelling conditions, and there is a multiple follicles, and after the treatment she has 2 or 3 follicles only in the ovary. Next one. Another case. Next one. It's about the name YK Makudia, age 28 years, female, occupation study. She is married, religion Hindu, vegetarian, address Bhavnagar, Gujarat. Next. Chief complaint, she has amenorrhea due to the inertia of a uterus, wall thickening, and it is a high prolactin level. Actually, couple was planning for a baby and difficult to conceive. Next. Mind, irritability +3, anger while contradict +3, crying spell +2, indifference +3, aversion to talk with husband even +3, sleeplessness +2, depression +3, dullness +2. Next. And the naturally menses were not appeared. Patient was under the allopathic treatment. 17th July took medicine. On the 13th August, on the 45th days. On the 17th October, on the 47th day, took a medicine. So after administration of a homeopathic treatment, she get periods on 29th December, 20th January, 13th February, and 8th March. Next one. So on the 13th October 2023, the prolactin level it is 144 and MH below it is 0.1. On the 20th February 2023, under the homeopathic treatment, she has the prolactin level it is 1.15 and AMH it is 0.282. So on the pregnancy test, on the 4th April test, it is on the first test it is the faint line. On the 8th April, the second test, there is a red line. Next. So the treatment, it is again go with, there is a constitutional remedy. It is on the base of the repertorial totality, the similimum. It is the pituitarinum, anterium 1M, the single dose. Next one. So it is, there is a result is here. The prolactin level, it is 144.2. It is directly up to there is a 1.5. So it is the miracles in the homeopathy. Go with, there is a SARCODES. It give a good results. Next one. Another case, it's about SR Parmar, 39 years, female. She is housewife and married. She is Hindu vegetarian and residing in the Bhavnagar, Gujarat. Next one. She has a complaint of hypothyroidism since 2019. She has a complaint of weakness +3, numbness +3, tingling +3 in the extremities. She has breathlessness, want to air, something. She has chest pain, aggravated at midnight. She has severe calf muscle pain, better by pressure. Complaint was started from the 2019 and patient was under the allopathic treatment. She has pedal edema on the right side, day and night, not reduced by the even rest. She was complained of a hair falling. Menses is regular but a scanty, breast tenderness before menses. Next, please. Sorry.
Sorry. This one?
Yes. Physical characteristic. Appearance. She is fair, tall, moderate structure and anemic. Weight 70 kgs. Perspiration profuse. Thirst it is less. Desire sour. Appetite increase. Stool constipated. Unsatisfactory stool. Sleep it is disturbed due to the anxiety about family. Next. Past history COVID-19 positive. Before 2 years, she had dengue before 5 years. Next, please. So I prescribe a Kalikap 200 single dose with there is a Seclec TDS for 15 days. Next, please. So it is all about, there is a follow-up chart. On the 18th July, there is slight improved. Kalika again repeat to in 200 potency. On the 7th August, she feels better. Seclec TDS for 1 month. 10th September, again slight improved. So go with there is a Seclec TDS for 1 month. On the 15th October, not much improved. So I again prescribe Kalika, but in the high potency, it is 1 m. And with there is a Seclec TDS for 1 month. At 10th November, again the complaint is as it is. Next, please. So I prescribe the thyroidinum 1 m because of there is a thyroid complaint as an intercurrent. Next one. And the result is here. It is almost there is a TSH level. It is 11 point something, and it is after treatment it is around there is a 4. So it is again well marked result with there is a SARCODES. Next, please. Case number 4. So it is the Anvaisha, 23 years female, study. She is studying, and there is a single Hindu vegetarian addressing it. It is Bhavnagar, Gujarat. Next. Chief complaint: irregular menses, PCOS since 5 years. Since 5 to 6 months with there is a premenstrual syndromes. Next. First menstrual period at the age of 13 years. Last menstrual period, it is the 2nd January 2024. Absence of a menses since 2 to 3 months. Menses irregular. Cycle 35 to 40 days. Duration 4 to 5 days. Flow, it is a scanty. Color, it is reddish brown and watery. Clothes +2. Next, please. Concomitants before and the beginning of a menstruation, it's dysmenorrhea +3, gas troubles, flatulence +2, mastitis +3, acne +3, nausea and vomiting, pruritus, irritable, mood swing +3. Next. Physical characteristic: she is obese, short heighted, and with skin tone. Weight, it is 70 kg. Perspiration profuse +3 at night. She is thirstless. Appetite is decreased. Stool constipated and unsatisfactory. Sleep is disturbed. Next, please. Mind: she has continued the dream about the death of the family members. Startle sleep. She feels bad energy nearby her. Feels bad touch. It is not safe. People doing back bitchings. Passes comments on the look. So I feel so shy with a low confidence level. People do comparison. I want to be something different, but I need support. Next, please. She had a dream. It is a future dream. I want luxurious life and my dream home. I want to be independent. Then I will do marriage and settle. I want to do my own business. Next, please. She has a past history of fissure in ano, urinary stricture. Next, please. Treatment: on the base of totality, there is a Brightacab 1 m single dose, Seclec TDS for 1 month. Next. The follow-up chart is here. So first prescription, it is the Brightacab 1 m single dose. On there is a 1st February, menses appeared but complain as it is. Again go with there is a Brightacab single dose. On there is a 1st March, she feels slight improved. So go with there is a Seclec for a 1 month. On there is a 5th April, there is menses appeared, not much relief in PMS. So next, please. I go with there is an intercurrent remedy, folliculinum. It is best acted remedy in there is a PMS conditions. So folliculinum 1 m single dose. Next, please. And the result is here. There is a ovarian cyst in there is a right ovary, and there is no any follicles or the cyst is present in there is a ovary. Next, please. Conclusion. So SARCODES, regulator of there is organ functions, correct the hypo or the hyper functions, hormonal and there is endocrinal balance, nutritional and the functional remedy. There is a restorative and the reconstructive actions, complementary to constitutional remedy, deep and gentle, long-lasting remedy. It's a long-lasting actions, remove the functional blockages. As an intercurrent supports the constitutional anti-miasmatic treatment, prevention and prophylactic actions. Next, please. So its affect, there is the physical, emotional and the behavioral health, addressing the mind, body and hormonal axis. Hormonal imbalance or the fluctuations, particularly in the estrogen and progesterone imbalance, impair the quality of life which improved. Conventional treatment is suppressive. Hormonal therapy has many side effects. So SARCOD is much safer, holistic and the safe approaches, and it is aligned. There is the PNI axis, it is the psychoneuroendocrine immuno axis, and it is enhanced and there is aligned the axis. Next, please. Thank you so much.
Thank you, Dr. Manisha, for your wonderful presentation. Really, it
Thank
is
you so much, ma'am.
very informative. I'll stop the share. And we have 20 minutes, 23 minutes more. The participants, if the participants have any question regarding this, you can ask. You can raise your hands and ask. Otherwise, if anyone have any question regarding this? So you are giving only one dose as an intercurrent, right?
Yes, ma'am. In between, as an intercurrent, and afterward, whenever it's required, I again administer the single dose.
Okay. I think there is no any no questions from the participants. Shall we discuss some more cases?
At present, ma'am, on PPT, I have any cases.
Okay.
If you want to ask something.
Participants have any question? Binoy.
Yes, ma'am.
Okay. Dr. Binoy, you can ask.
Hello, ma'am. It was a very nice session, and you covered the. Can you hear me?
Yes, yes, yes.
Okay. You covered like very important aspect of the medicine. I have one quick question. You mentioned about the adrenaline. Do you have a case related to that? Any cases you had?
Hello. Sorry.
Any cases related to adrenaline? Did you had any cases?
Cases related? Sorry.
Adrenaline.
Have you treated with adrenaline? That's
no. I don't have any cases related to adrenaline.
Okay. Can you explain a little bit how the dosage and all will be for adrenaline?
Actually, SARCODES is all about there is a defective remedies. You can prescribe in the higher remedies. In the lower potency, it is mostly with there is a there is a pathological symptoms. So go with there is a higher potency, but not repeat the frequently. In between, as an intercurrent or as a constitutional remedy, you can prescribe a single dose.
Single dose. Okay. So you said not frequently. Means.
No. Yes.
Is it a weekly once we can prescribe or more than? Like
I prescribe on the base of the patient's totality or the complaint, but after there is almost and there is a monthly.
Monthly one, okay.
Yeah, monthly.
With the constitutional remedy, right?
Constitutional remedy.
With the constitutional remedy, this can be repeated monthly once. Okay.
Monthly once, yes.
Okay.
Constitutional remedy also you have not repeated, right?
Yes, not repeated, ma'am. Yes.
Dr. Binoy, hope you got your answer.
Yes, it was.
In the positive way, you should just wait and watch. Don't repeat.
Don't repeat, basically. If the result is there, don't repeat.
Yes.
Or you have the cases that you repeated to, like a couple of times you repeated. No.
Cases so?
Did you have cases where you repeated the remedy? You said do not repeat it. Did you ever have cases that you repeated that?
I think Dr. Binoy's question is, if the case is not getting cured, what will you do? Am I correct, Dr. Binoy?
Yes, I was asking if she had any any cases where she repeated this remedy.
Not getting any result, then what you will do?
Again, I think it is the best to make out the recase taking or make out the totalities and again find out there is the best minimum. And if the action go with the first, there is a higher potency, and then go with there is a intercurrent remedies.
Okay. Thank you, ma'am.
Okay, thank you so much.
Okay, thank you, Dr. Benoy, for asking questions because we need discussion. Participants, please come forward and ask question to Dr. Manisha. We have time and it is better to discuss and know about the, the cases. Dr. Rama Devi. Dr. Rama Devi is our senior gynecologist, homeopathic gynecologist.
Okay.
Dr. Rama Devi?
So I think I get knowledge from ma'am.
Yeah. She's not
Please
answering.
give some suggestions if any required. So please guide me, ma'am.
She's not answering. Dr. Rama Devi? I think. Okay. Dr. Ram Parvesha, sir? Dr. Danish?
I just joined only, please.
Okay, Dr. Ram Parvesha, sir. Okay, sir, you can ask.
Thank you, Anjali, and congratulations, Dr. Manisha Boricha.
Yes, sir.
Very nice, excellent session. And
thank you, sir.
Describe the SARCODES remedy.
Yes, sir.
Very important remedy, SARCODES remedy.
Yes.
Tissue remedy and healthy tissue remedy. There are many kinds of preparation, biochemical SARCODES, structural SARCODES, and harmonial SARCODES.
Yes.
Lot of 40-45 remedy.
Yes.
SARCODES remedy. And intercurrent, very good result. SARCODES remedy. Lacanum, human, important remedy. Thyroidinum, pituitarinum. So, very excellent session. Thank you, doctor. Thank you.
Thank you so much, sir.
Thank you, Dr. Ram Parvesha, sir. And doctor, do you have small girls? I mean, nowadays many school-going children, they are not. They have amenorrhea. Can you explain such cases if you have?
Sorry, ma'am.
Teenagers amenorrhea. Nowadays we are getting, no?
Yes, ma'am. Again, I just inform that in the teenagers or the school-going girls, mostly there is a lifestyle disorders.
Yeah.
In these generations, this generation is because of there is a sedentary life, lack of exercise, as well there is a pattern of a food. Because PCOS, PMS, everything is nowadays considered as lifestyle disorders.
Yeah.
So first, it is. I think it is required the basic management portion, auxiliary treatments, as well as there is some kind of exercise with there is a constitutional remedy. So again, I'm just telling about there is a SARCODES, just like there is a folliculinum and ophorinum, the two SARCODES.
Okay. These are the suitable SARCODES for the.
For there is a menstruation troubles in the teenagers as well, puberty phase.
Ophorinum and?
Sorry?
Ophorinum and folliculinum.
Folliculinum, ma'am. And ophorinum. The best remedies for there is a teenagers to school-going girls. With there is a single dose or free, I think it is 2 or 3 doses, hardly it's required. And mostly there is a PCOS, hirsutisms, or there is a follicle cyst. It can be removed with there is a few doses.
Okay.
Madam, overinum or ophorinum.
Ophorinum.
Yes, sir.
Same remedy.
Sorry, sir?
No, sir. What you asked?
Ophorinum or overinum.
Ophorinum.
Ophorinum.
Or overinum.
No.
No,
Ovary
sir.
preparation, Sarcodes remedy, and ophorinum. It is same remedy. Name ophorinum or overinum.
Sorry, sir, I didn't get what you asked, sir. I'm pardon.
You're asking about ophorinum and overinum, right? Overinum.
Other name of ophorinum and other name of overinum. Same remedy.
Both are same remedy.
Sarcodes.
Sarcodes. Okay, sir.
We have 12 more minutes. Dr. Sheila, if you have any questions, you can come forward, please. Unmute yourself and come.
Hi, ma'am. Good evening. I have one doubt, but it is already cleared because I want to just ask. It is given only in higher potencies. That you
Yes.
already told, because lower potencies it will make aggravation. You already said, ma'am. So
yes,
I think 1 or higher than that we can go, or only 1.
Only one.
Okay, ma'am. Thank you so much.
Thank you so much.
Thank you, Dr. Sheila. In your opinion, Dr. Manisha, if we are treating with the constitutional remedy also, if we give one SARCODE, it will improve the cure, right? It will enhance the...
Actually, ma'am, sarcodes are the typical presentation in the similar way, like just sepia, lachesis, lichen, folliculinum, everything is going in the parallel. Whenever you go thoroughly these remedies, their all rubric is parallel. And I have suggest, madam, one repertory. It is like the remedy. It is the nosode and sarcodes. It is the bacteria square. It is specific remedy for the nosode and sarcodes.
Oh, okay.
And it is mentioned about the all nosodes and sarcodes, only nosode and sarcodes.
Okay.
Yes. So it is frequently added in the particular nosode and sarcodes if there is a female complaints. So you can go with there is constitutional remedy as well. Because they are all depicting remedies. Folliculinum, lichen, ophorinum is also act as a constitutional remedy.
Okay. So if we treat without any constitutional remedy, can we, if the symptoms agrees, can we prescribe SARCODE alone?
Yes, ma'am.
Okay. Anyone else? Dr. Rama Devi, are you not there? Dr. Satish Shalini, doctor, do you have any questions?
Overinum, it is source of anda se ekta है ना, focus, and overinum, source of ovary tissue. Source of ovary tissue. Overinum. Overinum, source of ovary, anda se. Okay,
is this questions in case of bleeding, how you repeat or dispense these questions?
Ma'am, I think in the mostly case with there is a menstrual irregularities, there are prolonged menses or scanty menses.
Hmm.
The cycle, it means it is more than the 35 or 40 days. In the PCOS or there is the PMS, and nowadays the cycles become a longer. So it is just like almost the 35 or 40 days. With there is the scanty menses.
So, in the bleeding cases, how you repeat or
Particular with there is a folliculinum and offurinum, it is mentioned as there is you can prescribe on the 14th day in the mid cycle or during a period on the 5th day. You can prescribe the medicines, it is act on the best way. And again, the folliculinum has correlation with there is the moon cycle, moon phases. Just like a leg can, so it is aggravate and there is a full moon. So it is just like a calendar year, moon calendar. So you can go correlate with there is a particular conditions.
Oh.
And with there is a scale, we can scale, there is a PMS scale. There is a premenstrual syndrome scale. So there are the group of the symptoms. It is a psychological symptoms, physiological symptoms, as well as their behavioral symptoms. You can make out there is a pre and post treatment. So it is a comparison you can go through, and there is a result you can match with there is a scale.
Okay. Dr. Victus, are you here? Let me check. Dr. Umadevi
Ajni,
came.
I was not able to unmute. I was hearing, but I was not able to unmute. This is my second phone. I was not able to unmute. Can you hear me?
Yes, yes, yes.
Yes, ma'am. Please.
You asked for amenorrhea of young girls.
Yes.
We can give lycopodium 10 2 doses, and we can wait for 1 week. Then even after 1 week, if the menses is not coming, try carcinosin 10, especially if they are having history of their parents are having history of diabetes or cancer.
Okay, ma'am.
You will get short this.
Okay.
There is no history we cannot give, right?
Yeah, it is better not to give if there is history. No, we can try carcinosin, but if there is any history of the cancer or diabetes to the parents, it acts more well.
Oh, if it is,
Thank you. Okay.
And
there is no history also we can give. If there is history means it will act
it works
fastly.
very well. Yeah, it works very well.
Strongly history of a diabetes or a cancer.
Yeah.
Then you can go with there is a carcinosin 10, right?
Yeah, cancer is carcinosin works very well. This is
Okay.
Dr. Late Padmanabhan's tip I got.
Okay,
Dr.
ma'am.
Padmanabhan only told me. And I have tried several times and I got result also.
Okay. Thank you, ma'am, for sharing tips.
This was very nice. Very nice presentation.
Okay, thank you so much.
For menstrual complaints, we used to give for
Madam, now it is there is a fluctuation in your voice. Now
this
but before it was clear. Before it was clear. Try to talk once again. I think. Now, please talk again.
Can you hear?
Yes, ma'am.
For menstrual complaints, we used to give folliculinum 3x TDS.
Okay, ma'am.
Menstrual complaint in the sense, or what?
Yeah, irregularity or this irregular menses or menorrhagia, anything like that, especially unmarried girls.
Unmarried girls. Okay, ma'am.
Thank you, madam.
Manisha, this one was very nice Very good. Thank you. Come
Thank you so much,
again,
ma'am.
please. Okay.
Okay, sure, ma'am.
Very nice.
Thank you so much, ma'am.
Okay. Okay.
Dr. Abraham Vaidyan. I think there is no questions. So we'll wind up the session. I think we'll hand over the session to Malayalam. It was wonderful. Your presentation, your slides, everything was very nice. You have put effort on.
Next time I'll come with more cases, ma'am.
Yeah,
definitely.
Yeah.
Yes.
Because I noticed that you are rushing. Within 1 hour we have to finish. No?
Yes.
That was in your mind.
Very short, and I can't complete my session. So next time definitely I will come with more cases.
Your thought was that I noticed, because I think you can take you can explain the slides more. You can take more time to explain the slides.
Okay.
Next time you come with more cases. Anyway, it was very informative for everyone. And in your in this age, you put effort on that. I'm appreciating you from the bottom of my heart, and thank you. Dr. Raj, you want to ask something? Or okay. Anyway, on Dr. Hariharan, just on like it. Anyway, thank you so much. Thank you, and I'm appreciating
providing a platform, ma'am. Thank you so much.
Thank you so much, and come again with more cases. We are
definitely, ma'am. Definitely.
Thank you. Thank you. SARCODES remedy, very important remedy.
Yes.
SARCODES are the remedy. Lac loenum, servi ka दूध, lac loenum, ऊँट की दूध.
When you are explaining SARCODES first, then you apply. Then that's why everyone noticed about the about that. You explained about the SARCODES. Okay. Dr. Victor, please. No, they are not asking question. I think they're talking there. Okay, Dr. Mariamma John, I am inviting Dr. Mariamma John for moderating Malayalam session. This is the end of today's English session. Thank you, Dr. Manisha Boricha, on behalf of IFPH, and thank you all the participants joining with us. Double thanks to those who come for discussion, because without discussion and without the interaction, the webinar is incomplete. Thank you so much. And now we are good night to everyone. See you the same time tomorrow. Love you all.
Thank you. Ghar Ghar Homeopathy.
I'm inviting Dr. Mariamma John for moderating Malayalam session. Dr. Mariamma John, you are welcome. Please.